Across the U.S., we are seeing an increase in opioid-related incidents. Opioids are commonly prescribed pain medications. In an effort to educate our staff, we are offering the opportunity for each staff member to be trained to administer naloxone. You will now hear from a member of our team, Ms. Jenny Stexton, about what naloxone is and how you can save a life.
Welcome to the naloxone training for Arlington County Public Schools. Some of you may wonder what naloxone is. Naloxone is a fast-acting remedy for an opiate or opioid overdose. So when an individual is overdosing on an opiate or an opioid, their body becomes very overwhelmed by the substance, which could result in an overdose. Some common opiates and opioids we see in our community include Percocet, OxyContin, Demerol, morphine, and fentanyl. This naloxone kit is an opportunity to save someone's life. If you find yourself in an overdose emergency, the naloxone will work in about 2 to 3 minutes. Today, we're going to teach you how to administer naloxone and save a life. Some common symptoms of an overdose are small, constricted pinpoint pupils. So for example, if someone has brown eyes, their pupils are going to be so tiny, the eyes will appear very dark. If someone has blue or green eyes, the pupils will be so microscopic that the eyes may look transparent. Someone may fall asleep or lose consciousness. They may have slow, shallow breathing or gasp for air. They may be demonstrating choking sounds or gurgling. They may be limp. They may be pale, blue, gray, or even have cold skin. If an individual has gray or blue lips, is typically where we would see that first, we need to get emergency services right away because they are beginning an exit out of life. Next, we'll talk about responding to an opioid overdose. The most important thing to remember is if you suspect that someone has overdosed, you want to carefully approach the scene. Please do not run up to the person because there could be drug paraphernalia, such as needles around the individual, or they could have microscopic amounts of opioids on their body, something like fentanyl, which 2 to 3 grains of it can be very dangerous. So carefully approach the scene and also put on your gloves, which will be part of your kit. Once you approach the scene and you've put on your gloves, you want to tap the person and check for responsiveness. You want to pull their ear, give a sternal rub, or if you know their name, just shout it repeatedly. If an individual is still not responding, what you want to do next is carefully look, listen, and feel for breathing. Now we say carefully because an individual could potentially come out of an overdose on their own. However, it's not likely. They also may just be sleeping. And so we want to carefully lean down and watch their chest, look, listen, and feel for breathing. We do not want them to jump up and potentially put your safety in jeopardy. Once you've determined that the person is potentially in an overdose situation and they're not responsive and they're showing signs of an overdose, we want to go ahead and prepare for the next steps. You want to contact 911. You want to let 911 know that you are a trained administrator of naloxone and that you believe that this is an overdose situation. Next, you want to let them know you're preparing to administer your first dose of naloxone. What you want to do is lay an individual flat on their back and gently tilt their head and their chin. Next, you're going to open the naloxone and you're going to take it out of the package and you're going to insert the plunger into either nostril and deploy the plunger until it stops. Once you've administered the dose of naloxone, you're going to next prepare for rescue breaths. What you want to do first is place your CPR mask on the individual's mouth, and it will cover the majority of their face. Next, what you want to do is you want to gently pinch the nose, and you want to give 1 breath every 5 seconds for about 3 minutes, or until EMS arrives. If the individual has not become responsive and EMS is not on the scene yet, and it's been 3 minutes, you want to go ahead and administer your next dose of naloxone and start the process over again. 1 breath every 5 seconds for about 3 minutes. Something to keep in mind, when an individual becomes responsive, there's a strong likelihood that they're going to be very agitated. They could be nauseous, they could be violent, so it's important once somebody starts to come to move yourself to safety. A few things to remember about naloxone. Naloxone will freeze. So we want to make sure and keep it at a temperature of 77 degrees or less. If it becomes freezing and you keep it in a vehicle, it will freeze. So if you administer the naloxone and it's frozen, it may not work to its full capacity. We also want to make sure we store it away from the access of children. Although it's not harmful, it is considered a medication. So we want to make sure that we're securing our naloxone in our school buildings or in our personal items. A couple other things to remember is naloxone does fall under the Safe Reporting of Overdoses law. What that means is individuals who overdose cannot face any criminal sanctions. Historically, if someone overdosed, they were charged with a felony possession of a Schedule I, Schedule II substance. However, as of July of 2020, that law changed, which encourages individuals to call for help. You're also protected by the Good Samaritan law. So if you do administer naloxone, there's no liability for you. Keep in mind, naloxone is specific to opiates and opioids. It will not work for the overdose of other substances, such as alcohol or benzodiazepines. We want to make sure we're safely disposing of all medication, including prescription medication, over-the-counter medication, and even pet medication. Unfortunately, with the opioid crisis, individuals will access any type of medication in an effort to try and get high. So we want to encourage folks to properly dispose of medications. There's 4 permanent take-back boxes at the fire departments here in Arlington County, so they can dispose of those there. They can access medication deactivation bags, or they can properly dispose of medications in their home. Thank you for attending today's training on naloxone.